Welcome back to the Legacy of Love podcast. I'm your host, Sara 𝐟𝐵𝐿𝐼𝐻. Today's guest, I'm so happy is here, and I'm happy to introduce you to. His name is Daniel Fortuño, and we are talking about all things public benefits. This month, I really want to dedicate a lot of the episodes towards supporting families and people with disabilities. It is National Disability Awareness Month. And so that is really one of the main reasons why I want to focus March on supporting families. And it definitely takes a village, I can say that. So let me dive into a bit about Daniel's background. He really is the expert in navigating this complex world of public benefits for individuals living with disabilities. So his company, Benefits Education Center, is based in California, and him and his team have really mastered the art of coordinating kind of this comprehensive public benefits that are available to individuals, from health coverage like Medicare and Medi-Cal or Medicaid if you're out of the state of California, and Social Security benefits like SSDI and SSI. So he really has a gift for teaching this stuff. He uses this term of comparing our public benefits and the whole system to a dysfunctional family. And I couldn't agree with that more. Daniel and I have worked together alongside many clients, and I can't say enough positive things. He's really brilliant at this and a true expert in understanding how to maximize public benefits. So, if you are someone with either a disability yourself, or you're a parent or have a loved one in your life with a disability, reaching out to Daniel, I couldn't recommend it enough, just to make sure that you're maximizing the public benefits that are available. And especially as a fiduciary, and when I work with people comprehensively over the many years, which a lot of times it's lifetimes and even multiple generations, people with disabilities really do need to have that safety net. And we talk about that in this interview. So you'll definitely want to stay tuned. I do want to just kind of preface that this interview, we go a little bit more deep into defining what is a public benefit and the different public benefits that are available in the United States. So if this is something that doesn't apply to you, you might want to skip this week. But I find more so than not, even if this isn't something that hits our immediate family, there's definitely people in our community that do have disabilities. I mean, so often just in my professional network and also my personal life, I meet more people that will talk about their neighbor down the street or someone close to them that might have a disability or be a parent to a disabled child. And so I think the more that as citizens we're empowered with this information and have a basic understanding, the more that we can really be that loving support and present. And if it's even just knowing about people like Daniel, they do exist, the more that we can just serve and help those. Again, we're going to dive into the public benefits available to people living in the United States. And we really get down into defining what is SSDI, SSI, Medi-Cal, Medicaid, and Medicare. So again, stay tuned, and I hope you enjoyed this episode as much as we did. Daniel Fortuño, welcome to the Legacy of Love podcast. I'm so happy you're here with me.
Thank you. Thank you for having me.
Yeah, so before we dive into all things public benefits related, I would love for listeners to know how and why you started doing the important work that you're doing.
I actually started working in benefits back in, it was the 80s, late 80s, early 90s, back during the AIDS crisis when there were not a lot of options for people. And it was really about understanding the best way to navigate a system which really was illogical. And at that time, we were trying to navigate things quickly so that people could get benefits before they died. And as a result, I wind up learning about understanding, getting to know people in programs like Social Security and California State Disability. And that's basically where my knowledge began and my understanding of this dysfunctional world began. And I did that work for many years. And then I kept on hearing people say, well, we need help. And so then I had a nonprofit for a couple of years where I did trainings on how to do this work. And I did trainings in California, Hawaii, and New Mexico. Then people were like, well, we actually need help, to get our clients on benefits. And then I started Benefits Education Center, still doing trainings, but then focusing and having private practice. And that's the evolution of me for the past more than 15 years.
Wow. I did not know that's where you started and how long you've been doing this work. So we've worked together for many years, but I did not know that background. That makes me appreciate you that much more. So for listeners, I would love for you to just define what is a public benefit. For me and you, I think we speak this language, all day, every day. But I think for some people, they're like, okay, so what is a public benefit? Can you define that?
Yeah, public benefits, the name is often given to a host of benefits. But when I think of public benefits, especially when I'm working with individuals that are dealing with things like special needs trusts, typically are the federal benefits, the state and federal benefits. And I don't dive down into the county benefits. So I'm thinking of things such as Social Security for both SSI and SSDI. I'm thinking of Medi-Cal, which is in California and other states is Medicaid, Medicare, which is health coverage that's provided by Social Security. I'm thinking of state benefits in 7 states or state programs that provide benefits. That pretty much is what I think of in my world, because I really focus on disability-based benefits. There are other benefits, like general assistance and food stamps and other programs, and I don't think of those in the world or even of housing as public benefits.
Okay, thanks for making that distinction. So let's maybe start with diving deeper into the benefits under Social Security
Okay.
Administration. So, do you want to start off with SSI or SSDI? I know that you know these benefits deeply, so we can go deep into probably each one.
To start out with, I always tell people benefits are like a dysfunctional family. They don't make any common sense, never have, never will. So you have to be ready when you deal with these programs to deal with an illogical system that's based on laws that do change, not often, but they do change. So, Social Security provides two programs for people with disabilities. There is the SSI program, which stands for Supplemental Security Income, and there is the Social Security Disability Insurance, which is the SSDI program. Two completely different programs. They're like twins. They look alike, sound alike, they're related, but they're completely separate from each other. So to begin with, the SSI program, and both of these programs, by the way, have the same definition of disability, which I'll go over shortly. But the SSI program is supplemental security income. So because it's supplementing, it's going to have the limitations of up to $2,000 in the bank, which is a law from the 70s where you could buy a Toyota Corolla or a down payment on the house. But it's still the same amount. You can have a house of any value and a car of any value, and they supplement depending on the state you're in. For 2025, the federal supplement is $964. And depending upon the state you're in, as an example, California supplements an additional amount, bringing the supplement up to $1,206.94. And I say supplement, meaning if an individual is entitled to another benefit, it pays the difference to bring them up to that supplementing amount. So the whole design of the program is to pay a benefit based on need. Where the SSDI program, Social Security Disability Insurance, that's a program that's based on contributions. And it's based on FICA contributions, which are the taxes that are taken out of payroll. And it could be the contributions of an individual, or it can be the contributions based on a parent to a disabled child. So the way it works is either an individual has paid into the system 5 of the last 10 years, and I'm giving you very high level explanation, not the fine details, or if you have an individual that has a disability that can be proven between the ages of 18 prior to 22 and has a disabled parent or retired parent or a deceased parent, they can get a benefit based on that parent's contributions, also taking into effect that the individual has never earned substantial gainful activity. So that means that the individual is disabled, evidence proving 18 prior to 22, has not earned substantial gainful activity, which is a dollar amount that every year is different. This year, 2025 is $1,620. They can get a benefit based on a parent's income. Now, let's get into the definition of disability. It looks like you have a question. Go ahead.
Yes, I wanted to just kind of pause and kind of say back this is what I understand, and also just for families listening, the big distinction between SSI and the SSDI is that SSI is really based on a financial need. So, quote unquote, low income. I think most people, when they hear the word public benefits, their go-to thought is like welfare, like SSI, where SSDI is based on disability, but it's based on what you've paid into the Social Security disability. And that's either you yourself, if you worked and then now you're disabled, or your parents. So, and that cutoff age is 22, correct?
The 22 is the cutoff age for when the evidence has to support that the disability is being proven. So you can have, as an example, you can have mom or dad retire at age 70, as an example,
Mhm.
and they have a 40-year-old child, but the child, you have the evidence that they were disabled after the age of 18 and prior to age 22, and that child can get a benefit at the retirement equal to 50% of mom or dad's contributions.
So I think this is like a huge part, and especially when I work with clients in the planning phase, I do work with a lot of families with, disabled children, and they might be young even, where they're setting up special needs trusts, or potentially there'll be special needs trusts. And, for younger kids, they're maybe they might have a diagnosis, maybe they don't, maybe the families are beginning to get some sort of services. So I'm seeing families like working alongside, the regional center, but they haven't really gone, this next step. And I think it's hard when your child's living with you, you're the parent. Sure, there's a need, but your child's going to continue to grow. So just for families, if you do, or if your child's ability and also disability is in question, knowing that in the back of your mind, you need to have medical records and documentation that this disability existed before the age of 22.
That's really, really important. A lot of times I'll have families that do not have the financial need for the SSI. And so because of that, they don't go after that benefit. And there is no clear maintaining records between 18 or development of records, 18 prior to 22. Mom or dad retires and then they lose out on the benefit that their disabled adult child, the term of art that's used for this type of benefit, could be accessing. So what I tell families is that it's really important as that child turns 18 that you begin to develop a medical record that captures, and what I like to nickname it is their truth. And what I mean by their truth, and to get into the definition of disability, if I may,
Yes.
the definition of disability, everybody thinks diagnosis, diagnosis, diagnosis. Well, it's like saying the word car. Well, that's a vehicle with four tires, but it doesn't tell me if it's a four-door or two-door, if it's a convertible. You need to be able to, beyond the diagnosis in the medical record, specifically capture how that diagnosis manifests itself. And the key thing is, what are the limitations? Two people can have the same exact diagnosis and it could present itself completely differently, where one person with the same diagnosis does not have any disabling features and the other one is totally disabled. So it's all about the clarity of the medical record and capturing it after age 18 and prior to age 22 so that you can guarantee. And right now we're highlighting, making sure that you get the records between 18 and prior to 22 so that you can get a benefit based on a parent's contribution in the future. What some families choose to do, even though they may not need it financially, is they'll go ahead and apply for the SSI benefit so they can get that designation or approval of disability from Social Security in what I nicknamed the sweet spot, 18 prior to 22, and the medical records where they need to be, because the law positively changed recently where they now allow what's called an adoption of a prior decision, where they had changed that negatively. It is now current that if you have an individual that has been on the SSI program between the ages of 18 and prior to 22, and they have not earned substantial gainful activity, when mom or dad retire at the local office, they can go ahead and put them on benefits based on mom or dad's contributions. And this is a law that passed last year positively, where they are now technically allowed to adopt a prior decision. So I'm recommending families, that child turns 18, you get the medical record where it needs to be. And when I say medical, I mean medical and or psychological, where it needs to be, so their truth is captured beyond just a diagnosis. So that when somebody is reading that medical record, the level of limitation is actually captured. Oftentimes, I'll have a family that says, well, at age 16, we had a beautiful neuropsych eval that had all the details we needed. And the neuropsych eval, there's nothing going to change. Well, yeah, but it happened before they turned 18. I had a young woman who was diagnosed as being blind at age 16. She turned 18 and we had to retest her. Illogical as it is the way the system works. The evidence that you're providing needs to be within that window of time that they're looking for. Otherwise, it will not be acknowledged in the way that the law is structured. Not logically, but the way the law is structured.
That's so helpful. And what kind of stays with me is this is a really narrow window, right? 18 to 22. And I mean, I think for, most families, that's like also when hopefully your child's leaving the nest, even if they, I work with a lot of families where their child, yes, they might have a diagnosis, they might be disabled, but their child's also pretty high functioning. But that's kind of like a, I don't know, a window where I think for any child, leaving the nest is a big step. And what I've also seen, and I know you've seen too, especially with mental health diagnoses, that diagnosis can happen, much later than age 22. So in that instance, then unless that person has enough working credits, then the only real resource that would be available is SSI. Is that correct?
That is correct. As an example, I'll have an individual who during that time period will go into a work program and attempt to do work activity and generate income that's greater than substantial gainful activity, the dollar amount for that calendar year, and have all kinds of accommodations that are given to them, but they're not formalized. But if you have accommodations and they're formalized, you can actually reduce the value of the wages of an individual by 50%. So, what I tell families, if the individual is trying to launch, if you would, my term, for an attempt to be able to do work, if there are accommodations, formalize them. Now, if the individual is able to launch and find a way to be accommodated and they're actually able to be successful, that's wonderful. I don't believe in creating a welfare box for an individual with a disability. What I believe in creating appropriately is a safety net. So what I don't want to do is cut hole in the safety net by doing work that's over SGA and not capture if there are accommodations and not formalize those accommodations if possible. So if we're trying to see if Johnny or Susie can do this work program, if there are accommodations, formalize them so that work doesn't become something that is looked at against them, and up to 50% of the value of the work is disregarded if in fact they have all of these special accommodations being done. Or look at the fact that if they're doing this work, they are going to be compromising their ability to get benefit based on mom or dad's contributions in the future. You have to weigh it out.
Yeah, and I think this is where working with, I mean, I was going to say someone like you, but working with you, I don't know anyone else that that quite serves families in the way that you do. Reasons why you're just kind of one of my go-to referrals, especially for my families in the planning phase that know that they might need to be applying for benefits at some point. Having this kind of comprehensive look and understanding each public benefit very well, and also having kind of the awareness of, it's a Goldilocks situation that's going to be unique for each family. So I think that kind of holistic, comprehensive kind of approach that you can bring to families is just such a gift. And also, I love that you say, our public benefits, this whole system is really dysfunctional. And saying that out loud, I'd never heard anyone say that until we worked together years ago. And it absolutely is dysfunctional. And, when I'm a trustee, for a special needs trust, and I'm really advocating for my clients' public benefits, putting those lenses on of knowing that whether I'm going into Social Security or somewhere else, that, the people that I'm working with are kind of just part of this dysfunctional system instead of that they're against me. I find that I'm able to go much further and do much better for the clients. And I absolutely know that's how you work too. So,
Very, very seldom do I ever encounter somebody who is working against you in Social Security or state disability or Medi-Cal. Often, what I come across are people that are overwhelmed, that are overworked, and sometimes may not even fully understand their own system because their system is governed by laws that are not based on logic. It's like a bad remodel. it's law after law after law. And it's like you look at the big picture and then, oh, we've got a new law that just changed the way that works. And so, they need to understand the laws as they're interacting with you. And it's not uncommon that I'll deal with a government agency and have to find a way to proactively educate them on their current law or what is actually current, which can be challenging, you
Yeah.
know.
So since we're touching upon this, I feel like we're going there. Let's talk about POMS and just you defining that because that's kind of what we're talking about specifically to Social Security Administration.
Okay, so POMS is Procedure Operation Manual, and it takes a real skill level to operate within the POMS system. Often I don't even get into the POMS when I work with somebody. I keep it real high level, and I'll bring about, whatever the most recent explanation. The greatest way to do it is the most recent online explanation that Social Security has provided. And then they quote the POMS with the numbering. And then you give that to the person. And then the POMS is like, it's like they give actual numbering. And then you provide that to them. And then they're often able to look it up. So I don't have the POMS memorized,
But you
you know.
know a lot of it.
I know what's in it. It's like, somebody who knows how to cook, and doesn't use the recipe book itself, and knows a pinch of this and a dash of that.
And for listeners that like have never heard this word, let's just tell them like roughly how many pages is the POMS?
Oh, I'd have to look it up online. The Palms is huge.
I know. I'm thinking it's like over 1,000 pages. I don't,
Oh God,
yeah, well
yes.
over. And
Yeah,
for me, I mean, how I see it is it's like the rule book or the Bible for Social Security. This is
yeah.
where if you're going into Social Security and you're applying for any public benefit, and especially if you need to appeal, you want to be working with someone that is familiar with the POMS because that's really how you're going to win that case.
Yeah, they need to understand the public policy, and the manual is absolutely huge. It's broken down, into I'm looking at right now the program operation manual system, which is the actual technical name for it. They have, the breakdown of how they do record maintenance, the breakdown of how they describe retirement survivors, disability insurance, supplemental security. It basically is the rule book. And whenever a actual descriptor of a particular program, that's where you find the meat of how things are described.
Yes, anyways, reasons where and why I love partnering with you because I know that you know so many of the I guess is it the palms what are the numbers actually called?
Forgive me, I don't remember what the numbers are called, but typically it'll be like, depending upon what you're describing, it'll be SI 005 colon eligibility as an example. They'll have numbers depending upon if you're going into disability insurance, DI 001 or DI 100, and then they go into what they're describing.
So Daniel, I want to ask you because I know when we're working together, it's kind of I think downstream. Like once, a parent has passed, typically I'm trustee of a special needs trust and I'm working with a beneficiary that either isn't receiving any public benefits or some and they're not maximized. In that kind of example, I know how you work, and which is wonderful. And you're asking for a lot of this information that we were talking about before, like medical records and a neuropsych eval. And if we don't have that, then going and seeing if we can get that. But again, going back to families in more of this like proactive approach, I know that you work with them as well. Do you come and kind of assess and make recommendations and kind of knowing, like looking under the hood of the car of where families can kind of maximize if it even makes sense to apply for public benefits? Are you able to do that level of assessment, or for you that feels like that's not your scope? Again, because we don't work together in that capacity, I don't know. So I'm more just curious, do you provide that service?
Typically, what I offer is an initial consult. And in the initial consult, I review what's going on with the individual case, meaning if it's, the individual with a disability or a parent. And I offer the initial consult at no charge, and I go over the fundamentals, what's going on, what kind of evidence do you have, what is your plan, what do you need. Now, some families will ask that I actually do an official write-up. Some families will ask that I actually review the records that they have. And I do have a records evaluator that has the ability to review the records to determine if the quality or the level of the detail in the records meet. And I haven't gone over this. Social Security has a book which is called the Blue Book, which actually has the automatic qualifiers, and they're called listing levels of impairment. And it has a diagnosis and then how the diagnosis needs to manifest itself, meaning with the symptomology to qualify as an automatic qualifier. And that is something that we're always looking to do. So, yes, we do have the ability to initially have that conversation. We do have the ability to look under the hood and actually look at the records. And I often will have conversations. The biggest issue that I have with families, because families often will have evidence, but the evidence is often not current or not for the correct period of time. I have, cases where they'll come to me, with a 33-year-old disabled adult child, and dad is retired, and the child was in college, 18 to 22, and, they knew about what was going on, but they were accommodating and there was no treatment, and I got nothing to work with.
Yeah, I see that a lot. Or, also with families that might have a good amount of means, and so their disabled child never applied for public benefits, but now mom and dad are deceased, and I'm working with someone in their 60s and 70s, and they could live a lot longer, and even with a good size, estate, if now we're looking at the cost of care, and typically we also need to work alongside like a case manager. I mean, there's so much that goes into supporting someone, obviously depending on the level of disability. But if you're just going at it alone, it can really downstream just do such a disservice. So I don't know. That's where I think as professionals, and so much of why I want to have this podcast and conversations like this is to hopefully make this information more accessible to families of like if this is in question for you, there really is a narrow window, and documentation is a huge piece. So anyways, again, I can only speak I can only say how wonderful you are to work with, and really, I mean, there's few people that do this work.
I appreciate that. My thing that I would like to give families as a takeaway, if you would, if you've got, let's say your child is 12 years old right now, and you're planning for the future. The key thing in my experience is, as however you're supporting that child, that's great, that's wonderful. But be aware the minute that child turns 18, you want to make sure that you have really good, clear records, regardless of what your family goals are, to be able to support that individual. If you want that individual to go to college or you want to try their ability to work, be realistic and have a clear understanding of any limitations that they have and have records, medical and or psychological records that captures their truth. You don't want to put them in a welfare box, as I nickname it, or say, Johnny, because you have this limitation, we're not going to let you thrive. Since,
Yeah.
if Johnny finds a way to be able to thrive, great. Maybe Johnny can find a career where Johnny can actually do something and actually earn a significant income where Johnny will be able to continue to work. It does happen. But if Johnny is not able to really do it, it's really important that you have documentation of the limitations that Johnny is dealing with from age 18 prior to age 22, so that if you want to capture benefits based on mom or dad or during that period of time, you're able to do it. It's very, very important. That's how you plan. That's what I call the safety net.
Mhm.
It's not a box, it's a safety net. And I try to get my families and the individuals with disability to see we're creating a safety net so that, whatever you're able to do, you can always fall back on it and it's there.
So before we run out of time, because I know this could easily be a 3-hour talk with you, I really do want to touch upon, we're in state of California, but Medi-Cal and Medicaid, because that is just a huge benefit, especially for our families and people with disabilities. So can you kind of touch on that public benefit? I know that sometimes it does tie into SSI benefit and the qualifications there.
So currently in 2025, January, the current laws are structured nationally in most states that an individual does not have to be disabled at Social Security level to get into the Medicaid system, which we call Medi-Cal. And key word is currently. That could change. Don't know what's going to happen.
Yeah.
Okay. So previously and currently. Now, the way the laws are structured in most states, if an individual, not all, is eligible for SSI, in many states, you're automatically linked in, and the term of art is called through an eligibility category for Medicaid, which we call Medi-Cal in California. That's not in all states. So whatever state you're in, you need to look to see if SSI has that automatic linkage. If not, you need to look to see what are the eligibility categories. Please be aware that the term of art eligibility categories may or may not be used in your state's website, although that is the term of art that explains the types of ways that you qualify. I like to nickname them doorways. So, as an example, in the state of California, there are typically 5 different eligibility categories, ways that individuals can qualify for Medi-Cal. I'll give you an example. There's the SSI linked. There's one that's called Age Disabled Federal Poverty Level. There's the 250% Working Disabled program. There's the breast and cervical cancer treatment program. So I've just described different doorways or ways. Doorways is my term. Eligibility category is the term of art that you can qualify to be eligible for Medi-Cal, which is Medicaid in the state of California. So you want to research and educating yourself as to what's available in your state is essential because every state is slightly different, especially when it comes to Medicaid. Social Security is the same nationally. The only part that's differently is SSI pays a different amount depending upon in the state you're in. Now, Medicare is a benefit that is directly connected to Social Security, and individuals with disabilities can get it under the Social Security Disability Insurance Program, either based on their contributions or being on a disabled adult child after 24 months of being eligible. So it's either 24 months as an SSI eligible, SSDI, eligible individual, or as a 24 months as SSDI as a disabled adult child. And that's the same exact Medicare that a senior is getting who's retired, eligible for Medicare at age 65. And Medicare comes in parts A and B, and then the prescription coverage is part D.
So in my mind, just again wearing the hat of a professional trustee, with my SNTs, kind of I don't know, the gold standard, the ideal is for a beneficiary to qualify for SSDI and Medicare and Medi-Cal. I don't know if you would agree with that, if you would correct that or add to it.
So let's talk about getting an individual in a four-wheel drive with fancy rims.
Yeah.
Okay.
Okay.
So I recommend an individual, regardless of what's going on with the family financially, the minute they turn 18 to get onto SSI. Now I'm going to give you the ideal scenario. Okay. They get onto SSI. They do have the limitation of $2,000 in the bank, one house, one car. They can open up what's called an ABLE account. That's the way you can have up to $100,000. And there are ways to deal with being on the SSI program if you're Bill Gates' son. Okay. As long as Bill Gates is not giving you money directly. Then when Bill Gates retires, that child can get benefits based on the parent's retirement. And because in that example, we got them on at age 18, we get to adopt a prior decision and they go on to disabled adult child. You don't have to have a medical review. And as long as we make sure that that child hasn't earned substantial gainful activity, we're good. And because in the state of California, there's the automatic linkage to SSI and Medi-Cal, there's a provision that allows the Medi-Cal to continue regardless of how high the disabled adult child benefits are. Now we have disabled adult child benefits that could be as high as $2,000 a month, $3,000 a month. We have Medicare and we have Medi-Cal.
Yeah.
Now we've just got all the bells and whistles.
So that's always kind of, I think, in the back of my mind, the ideal. And so much of this conversation we've talked about is kind of that narrow window of eligibility. So for listeners that have younger children that are maybe going at this more proactively, maybe this is something that, as you're building that safety net for your disabled child as they grow older and as you grow older, maybe this is what to aim for. And I know a lot of our listeners, don't have the younger child that's after the fact, they don't have medical records, and regardless of whether or not this person was disabled before the age of 22 or not, we're not going to be able to prove that. So then we're kind of working, and this is where, again, where we usually come and begin working together. We're kind of working with, okay, this is not the, ideal situation, but we're going to kind of do our best to maximize what is available. And so in that scenario, I guess my question to you is, at what point do we need to kind of wipe our hands and let go of fighting for that SSDI benefit? We're just going to accept SSI.
Right. If we know we do not have records 18 prior to 22 or a previous decision, then there's nothing to do.
Yeah.
And even though parents will say, but I know my child was disabled, they've always had the, well, where's the evidence? It's all evidence based. This is all evidence based. So if there's no evidence, no records that support it, within that, what I nicknamed the sweet spot, then it's just let's get the SSI based on, where we're at right now. And that would be, get everything in order, $2,000 in the bank, one house, one car in order. And then, make sure we have current records, because whenever you do an application, you also need to have current records for that application. The term current means less than 12 months, 12 months or less. And I literally have turned in records that are 12 months and they're like, we need something more current. I'm like, okay.
Waiting for the next statement to come. Right.
Let me go ahead and work with that doctor,
Yeah.
and we'll get you an updated review of the individual.
Well, I think that's, and again, I guess that's another kind of topic we could touch upon. But, once, especially with SSI benefits, I mean, there's the annual redetermination. With SSDI, I'm not finding that there's like this clear scheduled redetermination, but I know that Social Security does kind of reach out and make sure.
There are two different types of determinations. The SSI does an annual financial redetermination because that's part of what they are responsible to scrutinize.
And that's really like an audit of making sure that at, no point over the last year have you had more.
That you've not been over $2,000 and so on and so forth. But now both programs do a medical redetermination, and that is based on what's called a diary date. Whenever a decision is made medically and or psychologically, the case is assigned a diary date. And that diary date is when they're supposed to medically review a case. That's why I tell my families, getting approved does not mean permanent, total, your end. It means that you need to make sure that the medical record continues to capture the truth of the individual. But the disability is not going away. Well, no, the medical record needs to continue to capture the limitations so that when there is a future medical review, then there is a decision. Because what happens if there isn't current records, or if there aren't current records, either for the initial determination or in the future continuing disability on that diary date, they'll ask you to do what's called a consultative evaluation, which is where you see one of their doctors, which is a contractor, which in 90% of the cases, in my experience, are not ethical people, which will spend 15 minutes evaluating somebody. And those are the 80% of the cases that get denied. If you have good medical records, that doesn't happen if those records are current, that have the level of details that they need in them.
Oh,
You
oh,
need to be aware SSI is an annual financial. Both programs have medical determination based on diary dates. So you initially get on the program and you make sure the medical records continue to capture the level of detail that tells the truth. And it feels onerous. It's just, you just make sure that you have regular treatment. I tell my clients minimally twice a year, you get the medical record updated.
wow, that regular. And I think this is where, kind of, we've dived in deep. Well, not, I know you can go deeper, but we've talked a lot about the public benefits, but this is where kind of expanding out and thinking about the clients, that we both serve, especially for clients, where the disability is related to mental health. And you see where for these families and these individuals, a lot of times why they're not on public benefits. We talked before, a lot of times they're, having a mental health crisis after the age of 22. And so then that's too bad for them. They're not going to be eligible, I guess, for qualifying for SSDI under their parents', working history. And then the other piece is that so many of my clients with, whether they're schizophrenic or bipolar, they're really resistant to treatment and being seen by doctors. And there's a lot of paranoia and distrust. And
Yep.
so, for all of this, you again, kind of going back to where we started, what I see in my practice and just in life, I mean, these are the people that need the services the most. And this is where our system is so dysfunctional.
What I do is I recommend, I call it I have all these things that I call different things, the carrot system. What I do is I recommend that twice a year you create a carrot for an individual so that their medical record, it could be a video game, it could be a trip to Disneyland, it could be something that's important to that individual, because oftentimes an individual with a mental health disability is not going to have the mental capacity to understand when you say this is for your benefit, this is for your good, to really understand that they need to do that. Now, if they say, oh, if I do this, I get this, then they will cooperate in something that's uncomfortable, that they don't want to do, that doesn't make sense to them why they should be doing it. So that's what I recommend to families, is find out what are some of the treats that can help motivate that individual. Does your child have a collection of some type that they have? What are ways that you can motivate them to be able to participate in getting their needs met in treatment is what I talk about.
Well, I think this is a nice place to wrap up, but I think very much of this conversation, it just paints the picture for families where partnering with professionals, where this is, kind of what you do all day, every day. I mean, you can bring some easy solutions to families and really how we can maximize what is available to them. But obviously, the complexity, we only touched upon today. But I really want to thank you for coming on and speaking with us, informing the public about what public benefits are, defining that. This is just so helpful. And we'll, of course, link in the show notes for listeners of how to get in touch with you and find the important work that you're doing. And of course, reach out if they're kind of at the beginning or middle or downstream, like where I am process, because I think you're a unicorn. There's just few people that do what you do. So thank you, Daniel.
Thank you so much. I really appreciate the time, and thank you so much for your kind words.